Dr. Manllo, as a nephrologist, could you describe how poorly controlled diabetes affect the kidneys?
So diabetes is by far the number one cause of kidney disease in the US and actually worldwide. It's actually been estimated that 1 out of 2 patients who end up on dialysis is because of diabetes. So that's a lot. So that's why it's very, very important to control diabetes. Also because once you lose kidney function, there is no turning back. So prevention is key. Now, how diabetes affect the kidneys? It's in simple terms, basically what high blood sugars cause a lot of inflammation, also fibrotic changes into the kidney. And also, it actually activates a system called renin-angiotensin-aldosterone system. What it happens is it basically causes something called hyperfiltration. What does that mean is it just makes the kidneys kind of work harder. Okay, so when you have that problem for a long period of time, that actually what causes the damage to the kidneys. And that hyperfiltration is what also causes the kidneys to actually lose protein in the urine, which is one of the first signs that we see of diabetic kidney disease in general. So that's why one of the cornerstones of diabetic kidney disease treatment is blocking this system by using medications, which I'll talk a little bit later about, to prevent that hyperfiltration from happening, so actually you can prolong the life of the kidney itself.
And how do you diagnose the kidney disease in a patient with diabetes?
Kidney disease, for the most part, is asymptomatic, okay? So the diagnosis has to be clinical. You have to have a high keen of suspicion. That's why when somebody's a diabetic and they don't have any history of diabetic kidney disease, it's important, like it was mentioned before, to actually have screening methods. When we're talking about specifically about diabetic kidney disease, we look at basically 2 things. We look at the blood and we look at the urine. They're both as important. Why? Because urine could be the first sign of the kidneys having a damage. If you see protein in the urine and somebody's a diabetic, that's diabetic kidney disease. You don't have to wait for the creatinine, which is a marker that we look in the blood to see how the kidneys are filtering the blood. And then you should start treatment right away. So if the kidney disease is fairly advanced, you can have some symptoms, for example, like swelling if you're leaking a lot of protein in the urine. You might actually you might see bubbles in the urine. So they're very non-specific symptoms that you can actually see in patients. But for the most part, when you develop symptoms for diabetic kidney disease, it's actually too late. So that's why it's very important to actually do screening so you can catch this early, so you can actually potentially treat and even not regress, but actually delay the progression of the disease itself. This blood pressure control is very important. So we want to treat the blood pressure to less than 130/80. Of course, glycemic control is very, very important. Also, lifestyle modifications like regular exercise, smoking cessation, and weight loss are also very important as far as diabetic kidney disease. Now, when we talk about in general of medication treatments, for a long time, the only medications that we have available to actually treat diabetic kidney disease, what we call angiotensin receptor inhibitors or ACE inhibitors, and also angiotensin receptor blockers. Well, like I was mentioning, the problem with diabetic kidney disease is you have activation of the system, so these medications block the system. So yeah, you might see a little bit of an increase in the creatinine, but we know that in the long run, the decrease of that hyperfiltration actually protects the kidneys. And not only that, it also actually helps to reduce the amount of protein in the urine. And why is that important? Because we know that the higher the protein in the urine you have, the more rapid progression you're going to have of kidney disease. And we know if we delay that, if we reduce the amount of protein, you actually delay the progression of kidney disease. So that's why these medications are, all patients who are diabetic have protein or not even protein in the urine, they have to be on this type of medications.